Hello and good day to those of you who've been able to join our open online briefing of the 16th of April. Well, this is the first of the briefings that we're giving after quite a turbulent few days for the World Health Organization, and I'll discuss those in a minute. But today I want to concentrate on four things, I want to just start at the very beginning by acknowledging that there are colleagues and friends and family who've joined this who are new to our open online briefing series, and I'd just like to greet you all and tell you that we really enjoy being connected with you through this mechanism, and we really do hope you find it useful. The style is that I talk for a bit, and then we have a system through which you can ask questions and engage in a discussion through the chat function in Zoom. Please do use that, because we have the team here very well set up to deal with things. I usually forget to mention who the team is because I'm so eager to get talking. And so I just would like to introduce you all to Twee, who is handling the whole logistics of the call, Florence, who manages everything to do with the questions and comments and holds the whole thing together. And then out of our group, who we have the following: John Atkinson, working with me a lot on narratives and trying to interpret and make sense of what's going on. Catherine Deland, who helps me a lot with the health aspects. Magali Madi and Saber Moumen, who between them manage the elements of 4ST. Julian Delemonte, who is working in the local authority near here and gives us really good background information about how things are working in France. Joe Colombano, an economist who is keeping us fully involved in what's happening in the whole economic scene and co-wrote one of the narratives on the economics with me. And then other colleagues in the wider 4ST family who are here. Thank you all for being with us. It's a chance really to just share and to make sure that we are in a reasonably good shared space on what's going on. And it's when I try to share with you my insights of what's happening around the world. And I'm going to just tell you that the lockdowns are having quite an extraordinary impact. They're affecting half the world at the moment. They are reducing economic activity. There are all sorts of indicators of that. They're also, of course, having profound social and economic impact. And what I'm very much doing is working with governments on and others on coming out of lockdown and how that can best be done. I am particularly focused on the poorer countries and collecting information as it comes in from Asia, from Africa and Latin America. The virus spread in those regions seems to be slower than it might be because of lockdown, but there are the other challenges, which I'll come to in a second. We're looking very much at the moment on aspects of food and poverty and how the lockdowns and the pandemic are contributing to hunger. And then we will also focus a lot right now on leadership in world health. So as I go through my four headings and invite you to think about them, let me just start a bit about what this business of coming out of lockdown means. We've, in our group, seen it as trying to persuade as many people as possible to get real about this, that the virus isn't going to go away. We're going to have this virus in our world for the foreseeable future, and therefore we need to be able to live with the virus, and I call that being COVID ready. And it's a bit like the shifts that had to happen when it was discovered that dirty water carried cholera in 1854, or when it was discovered that HIV could be spread through sex about 25 years ago. You know, societies learn to live despite these threats and actually to find ways to go about their lives. It did require, in the case of the cholera story, the invention of sanitation, which I think has had lots of collateral goods. And obviously with HIV, we've had to learn to have safe sex and continue with intimacy. So in the same way, with COVID, societies will learn to live with COVID, and they will learn to be COVID ready. And it'll be a little bit of a difficult adjustment, but I think that right now we have to imagine what being COVID ready is going to look like, because that really has to shape what coming out of lockdown is going to feel like as well. And so we've got a sort of set of basic principles about it. Firstly, that all of society, everybody needs to know that this virus is dangerous. And they also need to know that if you don't watch it, you can get outbreaks building up super fast and have the challenges that we've seen in Italy, in France, and in parts of Britain, in Spain, and of course in the US. And so a really concerted societal capacity to close down any new outbreaks as soon as they appear is absolutely key. Now, many countries have got absolutely fixed on the fact that you can only do this if you've got virus testing everywhere. Virus testing is pretty difficult to do right now. It's a complex process, as I've said before, and it's just not feasible for there to be massive virus testing all over the world within a matter of days or weeks because of the need to urgently move out of lockdown. So I'm saying we need to learn to be able to identify cases and interrupt transmission on the basis of symptoms, i.e. what people are demonstrating, rather than on the basis of whether or not they've got the virus. It's going to make things quite complicated, because that may mean that anybody who's got respiratory symptoms will immediately be suspected of having COVID and will be asked to isolate. But I think that's a reasonable price to pay, rather than to have this virus continually roaming around society and actually killing an awful lot of old people and people with diseases like diabetes and hypertension. And over time, it'll kill a lot of young people too. There will just be we will gradually ratcheting up, and it will absolutely paralyze health services. So we're going to have to be, in terms of being COVID ready, able to hold back outbreaks when they start immediately, have hospitals that are able to cope with sudden influxes of patients with COVID, and have businesses and workplaces, of course, and farms and markets and social events that actually are respecting the fact that COVID is here. And that will mean that we will have to practice more distancing. And everybody at the beginning will get really kind of concerned about it and say, this just doesn't work, and we can't live, and we can't cope with it. But on the other hand, I think that gradually, and I don't think it'll be very gradual, I think it'll be gradually within a few weeks, we will all learn that if we've got symptoms of an upper respiratory infection, we must not get anywhere near other people. It will just become a badge of social responsibility. Just like, as I said over the weekend on a number of media moments, that wearing a mask in order to protect yourself will become a sign that you're socially responsible about COVID, and will do it. I'm absolutely convinced that societies will do it. As in Africa, when I was working on Ebola, I would learn that actually there are lots of practices in West Africa that are always adopted whenever an infectious threat comes into a village. There is a house that people go to where they isolate, because of an understanding that if they stay mingling with everybody else, then there'll just be a lot of death. Now, I appreciate that we won't all want to have that in our societies necessarily, but there will be ways developed to support people who have to isolate because they think they might have COVID, and they will be seen as being responsible. They won't be seen as being kind of losers or anything like that. It will be a sign of honor that you are doing that. And so trying to get that mindset right has been something I've been working on. Some of you might have heard one or two radio broadcasts where I've tried to do it. I'm careful, because the last thing you want to do is to end up with headlines saying, WHO envoy says we won't be able to have parties and cuddle up together and all that stuff. I don't want to put it quite like that, but we will have to be a lot more careful. And so it's thinking that through, and then talking to businesses about what that means, and talking to organizations about what that means, talking to conference organizers about what that means. That's what we've been really trying to do. And of course, I understand that this is politically very difficult for governments. We must have a plan for coming out of lockdown. You see that as headlines coming from many, many countries now. And so here is my suggestion. Coming out of lockdown, 1, make sure you've got really good local health services, able to detect people with COVID, able to isolate people, able to make sure that hospitals can surge when they need to, make sure that your health workers are protected. That's the big bubble that has to be in place. Then don't, I think, absolutely isolate your older people completely. I know there are people saying they need to be protected and defended, and I know there's big worries about how the whole care for older people is going to be done. But at the same time, social isolation is not desirable. It's physical distancing that's necessary. So I'm very keen that we think very hard about whether age is used as one of the criteria, and that there will be some continued locking down of old people. I know countries don't want to do region by region release of lockdown, but to me it makes perfect sense that if there's an area with high COVID transmission, that you actually do treat that rather carefully. You don't have people coming out of that and going elsewhere in the country, because that just acts as a centrifuge and sending the disease everywhere. And yes, I think sector by sector is going to be important. There are certain sectors that are really important for our lives, and we've got to make sure they're working. And right at the center of that is food, but also everything to do with health, things like pharmacy and so on. And I think personal care has got to come back. That means things like hairdressing and other such things. And there, again, special care is going to need to be taken. So schools, absolutely essential that we find ways to get schools to come back again. It's just, we should not be asking a whole younger generation to put their lives on hold for ages and ages just for the sake of this. We've got to find a way to get that going. So all this, the difficult decisions, what it means to be COVID ready, how you actually do release the lockdown. We are offering constant suggestions. We do have a chance to link up with governments, not necessarily on a totally routine basis. And I think that's right, because I think governments have got to work this through for themselves. They've got to have parliamentarians talking to them. They've got to have different ministers coming together. They must take soundings from civil society. And I hope that we can encourage that kind of multifaceted working, and it's all got to be done during the lockdown. It's no good doing it when the lockdown is released. And talking with colleagues from Italy, I kind of get that sense that the Prime Minister has realized that they've just got to work on it acutely. So they set up a really interesting council working on it. And what's nice in the Italian story is it's not just health people, it's health and the people working on the economy. And that does seem to be the same in Britain, though I don't know so much about it. In the US, I'm learning that it's been done, but it's quite hard to work out whether or not it's being done in any kind of sequential and systematic way. Now, number two, so that was my number one, sorry, being COVID ready in practice, dealing with the difficult decisions. Number two, what's happening in developing countries, the low resource settings? Well, I've told you before, and I'm going to say it again and again and again, developing countries will not have the resources to enable everybody who's got symptoms to have virus testing. I suspect that virus testing is being done for about 1% of cases, please don't quote me, but I really do see virus testing as only giving us a rough idea of where the virus is. And often the figures tell us more where the testing is available rather than where the virus is. No, it's difficult to know where the virus is in developing countries. Also because we don't have any reliable death statistics. And anyway, when people die, how do you work out whether they've died of COVID or died of something else? So the situation of knowing where the virus is and what it is doing in developing countries is super challenging. And we really have to base it on a small number of places where we know that the services are strong. I mean, I have good contacts at the moment, just coincidentally with the municipal authority of Mumbai, former Bombay, and I'm getting really interesting material on who seems to be getting the disease, who seems to be dying, how it's spreading, how they're managing in the slums. And what I'm hearing all the time is, as within other parts of the world, the deaths are in people with other diseases. It is diabetes, it is hypertension, and there is a lot of diabetes in Mumbai. So therefore, they are actually able to identify groups they've got to keep a special watch on. And they are finding it challenging to do the self-isolation, so they do household isolation, but in very crowded areas, that's difficult as well. So they're trying to do community isolation, and communities get really frustrated because they're not exactly kind of total fans of the government. And so there are big, big challenges with the isolation part, and they've got shortages of personal protective equipment. I mean, you might imagine that the shortages in Europe are bad, but in developing countries, they're a lot worse. and then there are the drugs problems, and then there's all the stuff about hydroxychloroquine and other possible treatments. It is challenging if you are the government of a developing country dealing with this. And if you've got a lockdown, you have to be super careful about the lockdown going on for too long. Because then I come to my third point of today, which is the fact is that a lockdown is super bad for people who are on in the informal economy on daily wages. They just don't have much cash in their hands. And as I keep being reminded, that particularly in Islamic societies with Ramadan now, only really, so it's a week away, that's going to make things very, very difficult indeed, because you've just got to stock up for Ramadan. And so the food situation is difficult. I got some good information from Indian colleagues yesterday that it's known in India that there's been a good supply of grains like rice and wheat. So there's plenty of grains in store, and that can be made available to people through the public distribution system. But then the more perishable and nutritious foods like fruits and vegetables, as well as dairy produce, they're not doing so well. And the whole poultry, eggs and meat sector seems to be in a very, very difficult state. And this is having a knock back effect on the farmers who are just having a cash crisis in much of India. And then, so you've got the problems at the farmer end, particularly those who are dealing with perishables because their market has gone and the logistics are not working. And then you've got a problem at the consumer end, poor people finding it hard to get food, their children not being able to get the nutritious meals they used to get until recently in the child feeding centres. And so at both ends of the food chain, problems at the production end and food insecurity at the consumer end. But the great thing is that the Indian systems for dealing with food insecurity that have been set up over the years have been brought into play. And according to my informants, they're working, but they never get to everybody. And so this problem of food insecurity associated with the confinement, and that indeed being necessary for containing the virus is proving to be very challenging. And it's not just in India, but it's in North Africa, it's in Southern Africa, it's in Latin America, and it's in the Middle East. And so working on the food side has been something that's been a focus of myself and many others. And today, most of today, I'll be involved in work on that, all the time working, connecting through these networks like this one, some of them very, very big, trying to help people keep on side. And then lastly, I did want to mention just the decision, well publicized by the President of the United States to remove funding by the United States to the World Health Organization. It was expected. And I think that most of us have a fairly clear analysis of why it's happened. That, however, doesn't help us to cope with the consequences of it for the whole process of dealing with the pandemic. I have worked very closely with the WHO teams over the last few days, and we've agreed that it's not useful for me to do significant amount of media work or other such things on what this means. But I thought I would share with you just a couple of things that I think are really important. Public health is a very interesting discipline. It's not like hospital healthcare where you're a doctor treating patients and helping them through their struggles, where your focus is on the individual, but it's much more focusing on the health of populations. And most of the people who work in public health are bound together by a fairly clear set of values. And they are that basically every human being matters, regardless of their sex, ethnicity, age, nationality, wealth. It's essentially a value system that is a truly humanitarian one. And that's actually what brings people into public health. And certainly it's been something that's been close in me for 45 years. But we are part of a network of people who have the same values. And we've developed over the years, as we work together, a sort of incredible sense of trust and respect for each other. We might have differences of opinion about what should be done to get the best possible result, but we are bound together by a value system. And it's quite difficult to maintain that sense of trust and respect, you know, especially if you find that every action that you do is being kind of scrutinized and assessed by political masters. Are you fitting in with their ideologies? And so the public health community have developed ways of operating under the radar, whatever the political ideologies there are around the place. And it's never easy, I have to tell you. It's never easy when you are focusing on an approach to health which is based on human rights and equity. And particularly when we get a big threat, we network. We work under the radar. We have all sorts of informal ways of communicating with each other to share our kind of anxieties, our understandings, our nervousness. And of course, those networks are really important when dealing with something like this, because if we sense that there's something building up in a particular place, we like to be able to tell each other. We like to be able to do it in confidence. Occasionally, authorities get nervous and they suppress us, but we are pretty much trying to communicate. I mean, when we have information that there are increases in ill health among poorer people in wealthy nations, which of course we are seeing in many wealthy nations, that is information that is politically very sensitive. So there may be efforts to try to suppress it, but the public health people, as I say, are linked together in networks. Hundreds of thousands of us, but right now, you know, everybody's a public health worker. Right now, in the middle of this coronavirus, everybody is making sacrifices for the good of all. And so never was there a more important time for there to be a global leading focal point for all of us who are working for public health, the World Health Organization. Of course, those of us who are therefore in that space wonder who on earth would want to actually try to humble the lead organization for global health right at this time. You know, anybody with any sense would realize there's got to be post-mortems on what's happened, and the post-mortems will be done and we will all be held to account. And we're used to that. I mean, we've been through post-mortems on so many other issues. So we continue to really try to understand what on earth brought a load of legislators to persuade the president that the best thing he could do would be to announce that he's cutting the funding to WHO. And so what we're seeing is actually a very interesting growth of a sense, not so much of outrage, but a sense of family among people working in public health. We have to stick together at this time, work together to do it without hesitation, continue focusing on the well-being of people. We're not focusing on politics or relationships between governments. We're not going to hold back from speaking out for the interests of people. We're not going to say or do anything that will mean that we hide information deliberately. We would never do that. No public health person would ever hide information that's for the good of the world. And we will go on doing that. And we have a mandate from governments to go on doing that. That exists, the International Health Regulations of 2005. And so I think all of us now need to be leading public health. And that was quite beautiful to hear Tedros making those points yesterday when he was talking at the World Health Organization. That's a long introduction. I knew that it was going to be, it was going to take me time to share that, particularly the point on leadership, but that's also because I want to keep making the point. Everybody is leading for public health at the moment. Everybody is acting for public health. Every one of you who's physically distancing is actually contributing to public health. It's great. We have people today connected in this online briefing from Kuala Lumpur, hello. From Amman, great to be with you. From Bangkok, and I think I recognize, yeah, you're there. Hello, hello, hello. Lovely to see my former colleague, Livelihoods, there and smiling. Oh, beautiful. Great that you're with us. And then we've got people from Vancouver. Must be super late at night. Thank you very much indeed for joining us. We have great opportunity to talk with Canadians yesterday about what they're doing, and Canadian leadership is just brilliant. It's because you had SARS and you knew what to do, so I understand that. We have people from more in Europe, from Rome, and they're just really fabulous to be talking to people from Italy yesterday on the routes out of lockdown in your country, but also recognizing just what a hassle it continues to be, particularly for poorer and homeless people. From Brussels, hello, thank you very much indeed for joining us. And La France, so good that you're with us, and I'm delighted to say that one of our colleagues on the phone today has been translating the 4SD narratives into French, and we hope they can be useful. Please find them on the 4SD website And any of you who's reading the narratives, especially if you think, oh, that's not much good, do write to us and tell us. You know how to get hold of me, you know how to get hold of Tweet. And if you think they're not helpful, just tell us or use the contact function on the website. And then we've got colleagues from UK. I'd like to say welcome to somebody from Brill, who I think that's near Aylesbury, who I think might be my daughter, if you're here. Hello, Polly. And welcome to your boy, Isaac. We've got people from Nottingham. We've got people from different parts of London, and more and more and more. These were just names that we knew, that we recognize, because they don't tell us exactly where we go. Oh, yes, and we've got a colleague from the Scale Up Nutrition Movement as well. Can see you there, Barbara. I think that's you, but just checking the names. Okay, so get Florence says I've got to get a move on. Sorry. Okay, so question 1. We've seen enormous variations in case fatality rates, even between broadly similar countries. Could these variations in lethality be explained by differences in testing and diagnosis between countries, or could there be other medical or epidemiological factors underlying this phenomenon? This is a constant debate and question all over the world. Now, when we work out fatality rates, we divide the number of reported deaths by the number of people who are thought to have the virus or the cases. So first of all, the denominator, that's the lower number, the cases of the virus, is always going to be dependent on testing. We can never say that the number of cases equals the number of cases. The number of cases is often a symbol of the amount of testing. And so obviously a country that does a lot of testing, even people with mild symptoms, may well have a much bigger denominator, and you might then end up with a lower death rate. So I want to stress the point here that it is differences in testing has a huge influence on the fatality rate. But then let's go to the numerator, the number of deaths. Some countries only count deaths in hospitals. Other countries count total deaths. And we've got information from all over the world that if you just count deaths in hospitals and you miss deaths, for example, in residential homes for older people, you will end up with a lower number of deaths. And then also, we have to remember that the actual number of deaths may depend on the age structure of a population. If you've got an older population, you're more likely to get more deaths, because we do know that this virus just carries away older people in a really horrible way. And thirdly, the death rate might be affected by the quality of medical treatment, i.e. if the healthcare system is totally overloaded, you get a higher death rate, and we found that early in Wuhan in China, than when the health system is calmed down. So I do ask people not to read too much into the death rates. And one of the discussions I'm having to have with people from developing countries is they say, I'm getting hammered because we got reporting high death rates. I say, you've got to be able to go back to people and say it's not that simple. And that's the case with everything we talk about. It's like when people say, if I have the virus, am I going to get reinfected? Oh, sorry, it's not that simple. And people don't like that. And that's one of the challenges of this, that nothing is simple. Thank you. So now question 2, what does the recent decision taken by the President of the US, acronym is POTUS, with regard to WHO say about the chances of a coordinated international response? Will it make this more difficult due to the US position, or will it encourage other countries to step up? So there are 2 features of this coordination I'm just taking time. 2 features of this coordination I want to talk about. One is strategic coordination, and the second is operational coordination. On strategic coordination, this is really important. I've been talking with Hans Kluge, the regional director for the World Health Organization in Europe, spanning from Vladivostok through to Limerick. You know, it's a really huge region, more than 50 countries. And Hans Kluge was saying to me, we do have a real challenge in Europe, and that is strategic coordination between countries. Because if you can't have similar approaches, particularly when it comes to the indicators used to try to release from lockdown, and to what will happen after lockdown is released, particularly with cross-border movements of essential goods and people, then it's very, very difficult to imagine a whole series of countries both dealing with the challenge emerging from lockdown, and then being ready to deal with any flare-ups. You see, the virus doesn't respect borders, but countries have a terrible habit of trying to work in very different national characteristics. So strategic coordination is actually really important, especially now with decisions being made about releasing from lockdown. Then operational coordination is things like countries helping each other with patients, sort of like we've seen with Germany and Luxembourg helping France, health workers having to move across borders, issues around food, issues around access to PPE and ventilators, and then of course the rather deeper challenge of finance that we've seen. And you know, I'm really sensing now that the fragmentation of political cooperation between nations that we've seen build up in the last 5, 6, 7 years after a time of really strong political cooperation, this fragmentation is aiding the virus in an extraordinary way and is hampering both strategic and operational coordination. I'm seeing some signs of operational coordination improving, particularly at frontiers, but it's not good enough. And I think that the issues around movement of essential goods and people really important, particularly using my Europe example, and strategic coordination really must be increased. And I think this US decision to leave does not help. I am hoping it will be a big kick to all other nations to realize that they've got to do better. And I have one good sign, and that is, and it's a tiny sign, and that is that the UN Secretary General's wish for there to be a ceasefire in order to help countries to deal with the impacts of the pandemic seems to be picking up steam. But goodness me, if only I could get some world leaders into a room and find some amazing device that would help them to just stop trying to pick fights with each other and to work together on this in a unified way. I think it would make the world an incredibly strong place. And I just wonder what kind of massive shock it will take for world leaders to understand that collective working is the only way to get through not just this crisis, but the crisis of nature and the crisis of migration and the crisis, most importantly, of climate change. So I shall continue, probably rather boringly like a broken record, saying, come on, we've got to get better strategic coordination that will enable us to have better operational coordination and at the same time deal with all the financial problems that, as we were hearing a lot yesterday from the IMF and from others, are going to be so serious. I don't know. I mean, what can we hope for? Actually, I think what I hope for is a massive petition by 100 million global citizens just telling the world leaders to wake up and get real and work out how best to work to come together on these issues, as they were able to do when we had the Paris Climate Agreement in December 2015. You know, we hadn't all gone mad. We were just working in an organized and sensible way. And until there is some kind of massive public pressure for that, I don't think we're going to see a shift. And we don't learn lessons from history, and we don't learn lessons from the present. So anybody who's got great ideas of how to do this, and there are people on this call who are working on this question, please let me know. We had a very good resolution from the UN General Assembly. You know, little things make you feel good, but turning that into actually countries working together, especially when they're neighbors, still a challenge. India, Pakistan, Nepal, where's the cooperation? Or cooperation across Africa, that's better because of the brilliance of the African Union. So there I have some hope, but there are other parts of the world where I just feel troubled. So question 3, I'm concerned about some people wanting to open up the country to go about business as usual, but the virus is by no means under control. This potential surge of new cases could hold us back from gains that have been made. What kind of advice supports this? Oh, thank you for asking that question. It is not a choice between opening up the economy and having ways to contain and defend against this virus. It is not. That is a false dichotomy. And, you know, not everybody is saying this. And so all of us have to be finding ways through all our networks to keep saying it's not a choice. Because in truth, You can only open up the economy if you are defending yourselves against further outbreaks of this virus. The moment there's another big outbreak, as we've seen in Singapore, by the way, a reimposition of physical distancing has to happen. Otherwise, it just goes crazy. In Singapore, they have got outbreaks in their special settlements for guest laborers. They're really worried about it. The Singapore figures are high. They have to lock down again. That's the country that we've been holding up as an example. But we still hold it up as an example because we say when they saw the cases rising again, they said, trigger, lock down again. So this notion that we're going to go back to business as usual, it's not true. We're not going to go back to business as usual. We're going to go back to what we call a new normal, the COVID-ready state, the capacity to have health people throughout communities, neighborhood health watches, reinforced public health services, hopefully testing, at least if the testing can be rolled out more widely, and well-organized hospitals that have got health workers that are properly protected, who know exactly what to do, not having to improvise. And then workplaces where there is respect for physical distancing. And then ways of socializing where we respect physical distancing, not all crowding in on each other. It will make sports events different. It will make parties different, but that's going to be the new normal. And so, thank you for that question. We have to find ways to keep making that point. And of course, it's not nice news. So nobody really wants to hear it, but it's the truth. It's the truth based on what we know now. We may know something different, in which case it'll be a new truth. But the truth based on what we know now is get the defenses in place, make sure they work, test them, and then release your lockdown. But if you release your lockdown suddenly and people just think, I can go out, do everything I normally do, we will have whacking great outbreaks because there's a lot of virus around at the moment. It hasn't gone away. It hasn't suddenly disappeared. It's around. So thank you very much for that question. Question 4. The IMF and the World Bank have started to grant funds in support of the least developed countries. Is there a risk that these new packages come with conditions that would not have been accepted if we did not have the COVID emergency? Somebody is picking up here on one of the big anxieties. I think most commentators have said that the emergency or catastrophe funds that should be made available by the international monetary system have to be without conditions. Now, of course, that's a tricky one, because if there is a condition that I would want to put in place, it is the importance of strengthening at the local level public health defences. I think it's really vital that all countries do that. Otherwise, they will find themselves left out when the global economy restarts. But I think if there are other conditions, particularly conditions that may go against what is the ideology of the national administration, then that can be very difficult. And we've seen before that conditionality, when money is given to poor countries, can have very pernicious effects. So there is a risk. And if you're a poor country and you've suddenly absolutely drained whatever reserves you've got in the bank in order to try to go out and buy COVID tests or protective equipment or masks at inflated prices on the global market, or you've had to deplete your reserves trying to give money to poor people who just have not got food to eat, you are not in a strong position when it comes to negotiating. So yes, there's a risk. And my colleagues who are working on this issue are watching that very carefully. But, you know, the IMF and the World Bank, the money is given to them by the rich nations. They don't print money themselves. And they have to operate under the conditions that the rich nations offer them. And so we have to keep coming back to what is the nature of the governments that have been elected in or have got into power in the rich nations, and how to make sure that they are truly global in their outlook and they don't put totally unreasonable conditions when money is given in order to support poor countries that have had to empty their coffers as part of their contribution to a global response to a disease that has multiplied massively in the rich nations and is now spreading from the rich nations to the poor nations. Again, there are things not quite right there. Question 5. Could I speak to the latest information about whether or not having had COVID means that you're immune from being reinfected? This is when I become a frustrating public health person. We don't know. Here's what's been found. There are more than 100 people who were tested positive in South Korea and then were thought to have recovered and are now testing positive again. And we're not sure whether it's because the virus was trapped inside their bodies and has come out again from its hiding places and has reinfected them, or whether they've actually been reinfected because after your COVID infection, although you've got antibodies, they're not sufficiently strong and powerful to neutralize against this virus because it's such a clever and deceitful enemy. Don't know. So there are masses of studies going on in animals as well as humans to try to test this. And I can't really offer a hypothesis, but I do remember with Ebola, when we were dealing with Ebola in West Africa, in the kind of recovery, what we called the getting to zero, it was a bouncy and difficult journey because there were people who we thought had been cured of Ebola, who then had the disease come all over again, and it was coming because of recrudescence of the virus from being hiding in places behind the eye or in the genitals in case of men, where it was being kind of put away, and suddenly, pop, it came out again, and that was a big problem. So, yep, I think that this is a major, major issue, and everybody is trying to work out what does this mean, because it has implications also for whether or not we will find it easy to develop an effective vaccine. So we're watching this super carefully, and our colleagues all over the world are discussing it today in the big meeting that takes place of all the different specialists from around the world. This issue of immunity and whether or not it protects against reinfection will be discussed intensively. That's why we need a WHO, by the way. Oh, that's why we need WHO. Who else is going to assemble all the evidence and try to make sense of it? Question 6. What are your thoughts on social distancing and air travel? Do we foresee the possibility of planes flying deliberately with low loads? Yep. Think of everything. I'm asking everybody in every sector, and I don't even need to ask them because they're doing it already, to start imagining how they're going to work with the constant threat of people with COVID in their midst. So hotels, what it's going to mean for hotels. Conference organizers, what does it mean for them? Restaurant owners, what does it mean for them? And airplanes. Airplanes. So number one, do we imagine that everybody traveling on an airplane will be expected to wear masks? Certainly, I expect aircrew will. Secondly, what kind of testing will be needed at the gate before you get on the plane? It won't just be a security check, it'll be a health check, and it'll be an intensive health check. Number three, when we have antibody tests, will people be asked to subject themselves to antibody tests? Yes, they will. But hang on, antibody tests only become positive several days after you've been infected. Are there going to be rapid virus tests? Well, they aren't available yet. So huge pressure from the airlines on the test people to come up with quick test kits. And then will people be expected to sit at least a meter away from each other and probably further? I think so, at the beginning. And will people be allowed to get on planes if they're coming from places where it's known to be, virus is known to be transmitted? Oh, they won't be at all. That kind of restriction will be there. So yes, I think air travel is going to be very different. And I don't think we should have any assumptions, any of us, that it's going to be like it was, where you can just tip up at an airport and get onto the last seat on a plane, even if you've got a bit of a cough and people get a bit cross with you, but they tolerate it. Somebody coughing on a plane, there'll almost certainly be a part of the plane where you're told to go and sit, be isolated. and there will be medical people who come and collect you when you get off, and you'll be 2 weeks in quarantine. And by the way, I think quarantine for arrivals will become the norm in many settings. I mean, we just got to really start thinking this through, and it's unpalatable for many of us, and for businesses, it's a horror story. But we have to think about it. That's what we've got to be doing now. Now. And I'm saying it to all companies that I talk to. Think it through. And once you start thinking it through, and especially if you've got the message about what the risks are, then you start to imagine the new normal. Question 7. There is some recent news about rapid tests being approved for use. Can you tell us more about them? And in particular, having a rapid test might change community and country approaches. So, the first thing is about testing is that we have to distinguish between 2 different types. The test for the virus, the thing that's causing the disease, and the test for how the body is responding to the virus, the antibodies that the body develops when the virus is inside you. The test for the virus usually involve testing for the whole virus, extracting the actual nucleic acid out of the virus, the RNA, and then looking to see whether or not it's the RNA that's specific for COVID-19. And those tests are difficult to scale up. I mean, I know how hard it's been for many governments to ramp up testing. There are a few governments that were lucky. They already had quite well-developed platforms for virus assays. South Korea did, Germany did and does, US did not, UK did not, and nor did many other European countries, just because it's a policy thing. And the reason why South Korea had it was because they had SARS, and they knew that one day they might need this. Now, so very rapid live virus testing is going to be not on the wide scale, but there are certain modifications, what's called the antigen test, where it's based on having bits of virus, and they might work. But always what happens is you worry about, first of all, is the test sensitive, meaning does it pick up even minute quantities? Because that's what you need. But then it picks up minute quantities, but is it also specific? Meaning, are these minute quantities just of COVID-19, or are there other coronaviruses that are getting in there and confusing things? And usually with tests, there's a trade-off. You're either super sensitive and not very specific, or super specific and not very sensitive. And so many of the rapid tests, whether it is for the virus, when it's just at the beginning of the infection, or for the antibodies against the virus, when the infection has been in you for a few days, there's a big trade-off between sensitivity and specificity. The overall word to describe that is reliability. And in summary, there are not yet reliable rapid tests for the virus or for the antibody available for widespread uses, except for the PCR for the virus, and except for some very rarefied, currently research tests for the antibodies. And the big race is to develop quicker, reliable virus testing and quicker, reliable antibody testing. The virus testing to find people who are at the early stages of the disease, for example, perhaps to deny them international travel or other such things, and absolutely for case finding, and the antibody testing for working out where the virus is in the community. So having a reliable rapid test would be brilliant. A reliable rapid virus test and a reliable rapid antibody test will revolutionize everything. So always companies are saying, whoa, this company's produced stuff, that company's produced stuff, it's been approved, so on. A lot of the approvals are for emergency use, and they're for emergency use because we're not quite sure about reliability. But watch this space, it will come. And so question 8, what can be done about the increase in food prices recorded in some countries? Answer, there has got to be very close watching of food prices. There should be no price, taking advantage of the situation by retailers or wholesalers to be just bumping up the price to make more money. And as I'm hearing about that more and more, I am asking that governments take action to try to deal with that and to try to prevent price rises from making it harder for people to get food. There will be increases in prices because of shortages. That's normal. But opportunistic taking advantage of it just to make money, that's where state intervention is needed. Thank you for that point. How can senior citizens be happy given this new reality with COVID-19 is here to stay? Okay, that refers to me. I think I'm a senior citizen. And I tell you, it does actually make me a bit anxious. You know, I'm anxious anyway because I'm an anxious guy, but this is a threat. And the reality at the moment is that we will not be able to know for certain as we're walking around in the streets or going to the shops or going to the barber or going to a party. We will not be able to know for certain whether the person who we're talking to might be at the beginning of their COVID, especially if they've taken some paracetamol or cough suppressant before they went out because they didn't want to be seen coughing, and they didn't want to be sweating and feverish. So much is going to depend on people being personally responsible and realizing that if they are feeling that the early stage of a respiratory infection, they're like a kind of human, they're a human threat. I nearly said something worse than that, but I don't want to get into histrionics. No, I think it's going to be tricky, and particularly for senior citizens in residential homes, because you depend so much on the ability of your staff in the residential home to keep themselves free of infection. And if you are in need, if you need nursing help, or if you need acute care help, or if you need a bedpan, or if you need to be helped to go to the toilet and other such functions, or to take them to the small restaurant area, or the occupational therapist has to come in, you're all the time going to be thinking, is this person going to have the virus? And the people who are working are going to have to think, well, I can't go to work because they've got the virus, and then they're going to be staff shortages. It's going to be tricky. But we will learn to live with this virus. I keep saying to everybody, you know, we just used to think things were so bad when we found out about other viruses. I remember terrible meetings. This is the end of love and stuff when HIV was discovered. We will learn to live with it. And we will do it together. Question 10, do I see the impact on food security and livelihoods being different from the impact of other kinds of shocks, such as the food crisis of 2008, except of course the scale? I've been thinking about that one. I do think that the impact, as far as I understand it, is on two ends. It's going to be a food poverty crisis because people are fundamentally being suddenly given a poverty shock. Now that's a bit like what happens in the country's economic collapse. I think one parallel might be what's happened in Venezuela. Though that economic shock was a bit more gradual. This is a really sudden, dramatic impoverishment. Bam, lockdown comes, no money. And what savings do you have if you're on daily wages or if you're in the informal sector? Usually none. You're usually in debt anyway. So I do think that's pretty unique that it's so sudden, such a sudden impoverishment. And then secondly, it's a supply side crisis, or really for farmers who can't get labor to pick their vegetables and fruits and it's rotting, or who can't get the vegetable and fruits to market, or when they get to market, nobody wants to buy them. So there's a real problem, a very acute problem for certain sectors of farmers. So it's the farmers doing fruit, the farmers doing veg, the farmers doing dairy, the farmers doing poultry and eggs for some reason in India are in big trouble, and also the meat farmers, again, because in all over the world, the meat trade has broken. So I think it's a very specific form of crisis, and I think it's potentially very, very bad, but also it's potentially soluble if governments recognize it as a poverty crisis, and if they can get liquidity into the cell phone bank accounts of people, if they've got those systems, or they can get cash to people. But there's lots of opportunities for it to go wrong. And I'm not sitting here thinking this is anything other than a terrible crisis all over the world, given that more than half the world is in lockdown right now. And it's a huge, huge demand on governments, on the one hand, who've got to try to strengthen up public health services really, really rapidly so that communities everywhere are on the lookout for disease. On the other hand, are having to manage massive relief programs for poor people who are in trouble. I am not underestimating this. And, you know, as with everything, you don't have necessarily the numbers, you have anecdotes and you make models or you have assumptions, but we don't need to use all that stuff for this one. We know that this is terribly difficult for poor people everywhere. And it's not just something to be talked about in seminars. This is something that needs action. I'm very pleased that we have Food Systems Dialogue's reference group this afternoon with about 200 people from around the world thinking how can they work on this in their local settings. And at least that's something useful, I think, that we can contribute. Question 11. Surgeon General of the US showed how to make a do-it-yourself rudimentary face mask. What is your position on such second best options given the PPE scarcity? Thank you for that question. No time, but number one, ideally, the good face masks, N95 or FFP or other similar specification particulate filtering masks must go to health workers, must go to people who are up close because they are needing them for their professional work. They ought to go also to people who've got symptoms because you want to stop them secreting the virus. But then for everybody else who feels they need protection, and more countries are saying we've all got to be protected in some way or other when lockdowns are released, then you go for what's called the second best, handmade mask or handmade face coverings. They may not be perfect, but they are, I think, in many settings, potentially life-saving. We've seen them being used in India. So my opinion of that is yes, but follow the advice of the Surgeon General. It's got to be close-fitting, otherwise it's not so useful. Question 12, can we expect to reach collective immunity at some point? Collective immunity is when a lot of population are immune to the virus. It's called herd immunity. And herd immunity means that we've got to have a large number of people in the population who've been exposed to the virus. But we are finding on the surveys that are available so far that actually the people who are exposed to the virus in the main get disease and know about it. There's a relatively small number of people who are completely asymptomatic. There are some people who have very light symptoms, but that means that there's not a huge amount of virus going all over the community like we get with flu. And so at the moment, yes, one day there will be collective immunity, but at the moment we are miles away from that. There are large numbers of people who are susceptible in every population. Liviu, you would like the floor. Please open up your mic, introduce yourself and talk. You need to unmute, sorry. Yeah,
okay, I'm unmuted now. Thank you very much. And thank you for giving me the floor. I'm Liviu. I worked with David 12 years ago or longer, and we worked on for many years on preparing for this type of events that people said they will not happen. But now to my point, I want to reflect a little bit on lockdowns because I counted, you pronounced the word lockdown about 17 times. And actually, no, I didn't count, but it's a good number. So I feel that the lockdowns is not a useful narrative. And I think since you're bringing your narratives, I think it would be tremendous if you can come up with a new narrative. What I'm talking about is lockdowns and curfews are borrowed notions from other situations. They're completely unhelpful during the COVID, and they're scaring people, and also they have no definitions. WHO is busy counting infections. WHO is busy doing everything else. We need another UN agency to define what is a lockdown and how do we talk about coming out of lockdown. We don't even know when we are in lockdown. In Bangkok, we have a curfew, which makes no sense. It's from 10 p.m. to 4 a.m. How is that influencing transmission? It doesn't. So I think what we need, and I think you have this tremendous potential to come with new narratives, it's distance proofing, transmission proofing of social and economic activities. We need a socioeconomic disruption index or indices, and we need to see the distancing. We want to increase the distancing and to reduce the disruption. And I think you alluded to this fact, the new normal. but I think some examples already exist. I was on a call today with Brunei, and they are talking about an algorithm to allow people to go back to mosques based on, and there are tons of these examples, and I think if it can be put together into a new narrative of a new normal, it would be tremendous. Thank you.
Well, we were together. We worked together on these kinds of things. I use lockdown because that's what others use, but I think that's a really good reminder that we can use the opportunity to create new language, new narrative. And I see colleagues who've been working with me on this nodding, but Liviu, we will follow up. As always, your head is right up where it is. It's your kind of head that will help the world to get ahead of the virus. Thank you so much for joining us, Liviu. Thank you, everybody.